Did you know? Condoms, when used perfectly, can prevent pregnancy with an impressive 98% effectiveness. But in real life, human error drops that effectiveness down to about 85%. Why? Because a lot of us aren't using them quite right, and even small mistakes can make a big difference. So today, we're diving into everything you need to know about condoms, how they work, the different types, how to choose the right size, and, most importantly, how to use them correctly to ensure maximum effectiveness. Whether you're new to condoms or you've been using them for a while, there's probably more to know than you think. Let's make sure you're equipped with all the information you need to feel confident and in control. Section 1: How condoms work and why they're effective. Condoms work as a physical barrier, preventing sperm from reaching an egg. When used correctly, they're an incredibly reliable way to prevent pregnancy. They're also a great choice because they're accessible, don't require a prescription, and are available in various types and sizes. Here's the big thing to remember: effectiveness is all about using them right. For perfect use, follow every step carefully, every time. According to Planned Parenthood, they can get you up to 98% protection. But with typical, real-life use, that number drops to about 85% because of common mistakes. So, let's talk about how to avoid those mistakes. Section 2: Types of condoms. Finding what's right for you. Condoms aren't one size fits all, literally and figuratively. There are two main types: external condoms, worn on the penis, and internal condoms, worn inside the vagina. Each has its own unique benefits, so let's break down the differences. External condoms. These are the most common type, typically made from latex, polyurethane, or polyisoprene. They're stretchy and designed to fit over the penis, creating a barrier that keeps sperm out of the vaginal canal. Internal condoms, worn inside the vagina. These offer an alternative to external condoms. They come in one size and fit snugly within the vaginal canal. Knowing your options helps you and your partner find what works best. Comfort is key for successful condom use, so pick the type and material that feels best for you both. Section 3: How to choose the right size. Size can make or break, literally, the experience. A condom that's too tight can feel uncomfortable, while one that's too loose might slip off. So, how do you figure out what size to use? Here's a quick guide. External condoms. Sizes like snug fit or large vary by brand. For the most accurate fit, check the brand's website for measurements and compares with your own. Condoms are quite stretchy, so standard size condoms generally fit most people. However, if you or your partner prefers a snugger fit, exploring different options can help. Internal condoms. These only come in one size, designed to fit securely inside the vaginal canal. Finding the right fit improves comfort and effectiveness, so take a little time to pick the best one for you. Section 4: Proper storage. Where not to keep your condom. Think a condom is safe in your pocket, wallet, or car? Not so fast. Exposure to heat, friction, or moisture can weaken it, making it more likely to break. For the best protection, here's where to store your condoms. Keep them cool and dry. A drawer or cupboard at home is ideal. Avoid storing them in your wallet or pocket for long periods. If you're on the go, place them in a bag, pocket, or toiletry bag a few hours before you plan to use them. When in doubt, remember that condoms last longest in cool, dry places, so treat them with care. Section 5: Expiration dates. Why you should check. Yes, condoms have expiration dates. And for a good reason. Expired condoms are more likely to break. Here's what to do. Check the expiration date on each condom's package. Inspect for any tears or damage on the package before opening. Even if the condom hasn't expired, any small puncture can lower its effectiveness. Taking a second to check the date and condition of each condom is a small step that can make a big difference. Section 6: Using condoms correctly. Step-by-step guide. Now let's get to the crucial part: how to use a condom correctly. 1. Putting on an external condom. Wait until the penis is fully erect, then carefully open the package, not with your teeth. Place the condom on the head of the penis with the rolled side out. Pinch the tip to leave room for a semen, then unroll it down the shaft. Make sure there are no air bubbles, they can cause breakage. If you want, apply a small amount of water-based lubricant to reduce friction and improve comfort. 2. Removing an external condom. After ejaculation, the wearer should hold the base of the condom as they pull out. This prevents it from slipping off. Tie the condom in a knot to contain the semen and dispose of it in the trash. 3. Inserting an internal condom. This can be inserted up to 8 hours before sex. Squeeze the inner ring and push it up the vaginal canal until it's snug against the cervix, with the outer ring hanging about an inch outside. 4. Removing an internal condom. After sex, gently twist the outer ring and pull it out. As with external condoms, tie a knot to contain the contents and dispose of it. Section 7. Myths. Should you use 2 condoms? Here's a common myth: 2 condoms are better than 1. Actually, using 2 condoms, internal or external, can create friction between them, making them more likely to break. Stick with 1 condom and, if you're especially cautious, consider adding a second form of contraception, like birth control pills or an IUD. Section 8. What to do if a condom breaks. Accidents happen, and condoms can sometimes break. If this happens, stop immediately. Here's what you can do next. If you're using other contraception, like an IUD or birth control pill, pregnancy is less likely. Emergency contraception, EC. If not, you can get EC from most pharmacies without a prescription. EC is most effective when taken as soon as possible after the incident, up to 72 hours later. For those concerned about sexually transmitted infections, STIs, consider getting tested. Some health clinics offer post-exposure prophylaxis, PEP, within 72 hours of exposure to help prevent HIV transmission. Section 9. Condoms in the menstrual cycle. Why timing matters. Pregnancy risk varies depending on the stage of the menstrual cycle. Ovulation typically happens about halfway through the cycle, with the highest chance of pregnancy in the days surrounding it. But remember, sperm can survive up to 5 days in the body, so sex before ovulation can still lead to pregnancy. To stay on the safe side, it's best to use condoms consistently during all stages of the cycle, even during menstruation. Conclusion: using condoms as part of your overall contraception plan. In the end, condoms are highly effective when used correctly. But no method is 100% foolproof. That's why many people choose to pair condoms with another form of contraception, like the pill or an IUD, for extra peace of mind. Remember, practice makes perfect. Take a moment to ensure you're using condoms right every time. With the right size, proper storage, and careful use, you're not only preventing pregnancy but also protecting against STIs. Keep this guide in mind and feel confident in taking charge of your sexual health. Thanks for watching, and don't forget to hit the subscribe button for more content on sexual health and wellness.